Sleeping positions during pregnancy. From your growing bump to heartburn and a constantly full bladder, it can be harder to get an undisturbed night's sleep in pregnancy. It's normal to feel tired in pregnancy, so try not to get frustrated with yourself, as getting worked up can only cause more sleeplessness. Your baby is growing, and your expanding bump is understandably making it hard for you to get comfortable at night. Bladder problems can be twofold in pregnancy. Early on, you might still find you need to pee more often due to changes in your hormones during pregnancy. Just as this is settling down in later pregnancy, your growing uterus puts pressure on your bladder, meaning more toilet trips again. Try not to drink too much water or liquid for a couple of hours before you go to bed, so you're not up so often in the night. Nearer the end of your pregnancy, as your baby's head engages, your bladder might feel full even when you've just been to the loo. Try going to the loo before bed, then try and make yourself as comfortable as possible. Here's some help wading through the myths and facts related to sleep positions during pregnancy and how the way you rest affects the health of your baby and you. 1. Sleeping on left side. Sleeping on your left side is often referred to as the ideal scenario during pregnancy. Positioning yourself on the left side of your body allows for optimal blood flow from the inferior vena cava, which is a large vein that runs parallel to your spine on the right side. It carries blood to your heart and, in turn, to your baby. Sleeping on your left side also takes the pressure off your liver and your kidneys. This means more room to function properly, helping with swelling issues in your hands, ankles, and feet. 2. Sleeping on right side. It is equal safety with sleeping on the left and right sides. There's a very slight risk of compression issues with the inferior vena cava when you sleep on the right, but it's mostly a matter of where you're most comfortable. The major blood vessels in the body run just next to the spine on the right side of the body. After about 20 weeks, the weight of the uterus can compress these vessels and decrease blood flow back to your heart and also to the baby. Sleeping on right side might also increase the chance of stillbirth. So, minimize your sleeping position at your right side. Tips for sleeping on your side in pregnancy. Put pillows behind you to prevent falling on your back. It won't prevent you being on your back for certain, but is likely to make it more uncomfortable. If you have long hair, try tying it in a low bun, which may make it uncomfortable to sleep on your back for any length of time. If you wake up for any reason during the night, check your position and go back to sleep on your side. If you are likely to nap during the day, pay the same attention to sleep position during the day as you would during the night. 3. Sleeping on stomach. In the early days of pregnancy, it is fine to sleep on your stomach. Your bump will not start showing until the second trimester, and sleeping on your stomach is unlikely to be uncomfortable. In the third trimester, you will have a large bump, and it is very unlikely that you would choose this position. However, if you do wake up on your stomach, don't worry, just roll onto your side. You can sleep on your stomach during pregnancy at least for a while. Stomach sleeping is okay until you reach about weeks 16 to 18. At that point, your bump may be growing a bit bigger, making this position less and less desirable. It may feel a bit like you're trying to sleep atop a watermelon. Besides comfort, though, there isn't much to worry about if you somehow find yourself on your stomach. The uterine walls and amniotic fluid protect your baby from being squished. To make this position more comfortable, you may consider purchasing a stomach sleeping pillow. Some are inflatable and some are more like a firm pillow with a large cutout for your belly. Whatever one you choose, the idea is that you get some shut-eye on your stomach while giving your baby and you plenty of room to breathe. 4. Sleeping on back. Sleeping on your back is generally considered safe throughout the first trimester. As well, some experts point out that it may only be sleeping an entire night on your back that's dangerous, which is nearly impossible with all the bathroom trips and insomnia you may be experiencing. Plus, there are some other issues with sleeping on your back. This position may contribute to back pain, hemorrhoids, digestive issues, and poor circulation. It may make you feel lightheaded or dizzy. Don't worry if you wake up while lying on back position, just change your position. If you're a solid sleeper and often find yourself on your back, consider placing a wedge pillow behind you. That way, when you try to roll onto your back, you'll stop at an angle that will still allow blood to flow and nourish your baby. Research has shown that in the third trimester after 28 weeks of pregnancy, going to sleep on your back increases your risk of stillbirth. Our advice is to go to sleep on your side in the third trimester because it is safer for your baby. 5. First trimester. Sleeping in any position is generally fine early on. But if you want to get into the habit of favoring your side, try simply slipping a pillow between your legs. This may ease discomfort in your hips and lower body as you adjust. And if you want to be a little, well, extra, you could consider getting an orthopedic knee pillow that's made of memory foam. 6. Second trimester. As your belly grows, you'll want to make sure your mattress is somewhat firm so your back doesn't sag. If yours is too soft, you might consider slipping a board between your mattress and box spring. You may also want to look into pregnancy pillows. They come in U or C shapes and wrap around your entire body to help with side sleeping. You position the pillow so that it runs along your back and then hug the front while simultaneously slipping it between your knees. 7. Third trimester. Continue using a pregnancy pillow for support. If you find them a bit cumbersome with your growing belly, investigate wedge pillows. You can stick them under your belly and behind your back to keep yourself from rolling. If you simply can't get used to sleeping on your side, try using pillows to prop your upper body at a 45-degree angle. This way, you're not flat on your back and you take the compression off your IVC. Alternatively, you can try elevating the head of your bed a couple inches with books or blocks. There's a lot you may worry about during your pregnancy. Your sleep position doesn't need to be top of the list. Doctors recommend resting on your side, right or left, to give you and your baby the optimal blood flow. Beyond that, you might try using some pillow props to get into the most comfortable position for you. Soak in all the sleep you can before your baby is born. And consult with your doctor if you have other questions about which position is best.